Probably one of the most important success factors in the ICD project was a strong governance model. Having clarity on who our executive sponsors were, roles and responsibilities throughout the project, and knowing exactly who the decision makers were along the way. The other critical success factor was stakeholder engagement. Different stakeholders might have defined value differently or might have brought different priorities to the table. So really important to engage early and often in fact-based discussions to make sure that every voice was heard and to make sure that we had alignment of all of those parties going forward. As part of our early and often engagement process, we met with folks individually, and then we also brought people together in groups to make sure that we were taking inventory of what we were hearing and were synthesizing the themes and playing them back to the stakeholders.
CorHealth brings a couple things to the system that I think are unique. One, we have strong relationships with our stakeholders, so that would be physicians as well as the hospitals and the care providers in the system. They've come to see us as sort of a trusted middleman between government, the funder, and the providers within the systems. We maintain a number of data sets which we use to provide objective information about the suitability, the quality, and the outcomes of the services delivered in Ontario for cardiac services. So as healthcare gets more technology driven, I think partnerships like this one are going to be more and more and more important for a number of reasons, but really it's because it gets really complex. Our funder, the Ministry of Health, can't actually have all the clinical knowledge and all the procurement knowledge required to do this effectively across all of the parts of government. So our partnerships become critical. Our government begins to rely on us as a trusted advisor on, from our perspective, how would I deliver high quality care? What does quality look like and how would I measure that? These types of partnerships are going to be critical moving forward because the outcome of that work is truly from some of the technology. Patients spend less time in hospital, they return to their regular way of living much quicker, much less rehab, less cost to the system with better outcomes.